Before we talk about self-compassion, let's talk about compassion itself. What does compassion mean? So this is one of the definitions of compassion. It is being touched by the suffering of others, opening one's awareness to others' pain, and not avoiding or disconnecting from it, so that feelings of kindness toward others and the desire to alleviate their suffering emerge. So basically, compassion is about having this feeling of kindness toward others, where you want to help others as they're going through some sort of suffering or difficulty, and you want to help them get through that difficult time. So that is what compassion is. So unfortunately, we suffer compassion fatigue, and that's where a caregiver has reduced capacity or interest in being empathetic and compassionate. And compassionate fatigue is really a form of burnout. So we have to recognize if we are suffering from compassion fatigue, that we might be on the verge of starting to burn out. So what is compassion fatigue? Basically, is being overwhelmed by all the dreadful events and conditions in the world that make us feel powerless to make a difference. So this could be true for patients, where as students and residents and practicing physicians, we may feel powerless in making a difference in the care of our patients. And that can lead to compassion fatigue, and we're overwhelmed by that. And right now, as I'm making this video, while we're in the middle of the COVID pandemic, so a lot of the healthcare providers are feeling compassion fatigue because they're overwhelmed by the volume of patients that are needing to be cared for, and the feeling that sometimes it doesn't make a difference, and the outcome can still be not what you were hoping for. And this compassion fatigue, it might not only be just for patients, it could be for anyone who's also not in healthcare, where you just kind of feel overwhelmed by the situation of the world. Again, with the COVID pandemic, a lot of people who are not in healthcare are feeling compassion fatigue, because you feel powerless in being able to do something for your loved one or your family, as they might be suffering from the COVID during this pandemic. So compassion fatigue is having that type of feeling. Okay, so getting back to compassion, it's very important for healthcare providers to have compassion, because patients who perceive a lack of empathy and compassion in their care tend to sue for malpractice at a higher rate. And those patients are less likely to return for care and have poor clinical outcomes. So providing compassionate care as a healthcare provider is very important in developing a strong relationship with your patient. So we must maintain compassion for our patients and maintain compassion for others, but we have to realize that we have to maintain compassion for ourselves as well. So while compassion for others is celebrated as a virtue, self-compassion is often incorrectly equated with self-esteem and viewed as a selfish or overly self-centered type of feeling. So it's interesting, we are so compassionate for others, we want to be compassionate for others, but somehow having self-compassion is looked down upon. Somehow it's viewed as being selfish. So we have to change this perspective, because self-compassion is such an important aspect that we have to take care of ourselves to help us prevent burning out. So self-compassion, it is a very, very important component of resilience, and we must develop self-compassion as a resilience strategy. And we know from the literature that there's a positive correlation between self-compassion and well-being. And we also know that self-compassion can be a means of resiliency against stress, against burnout, and against emotional exhaustion. So again, self-compassion is a very important resilience strategy that we must develop to help protect ourselves from burning out. So this quote helps summarize what is self-compassion. Self-compassion is simply giving the same kindness to ourselves that we would give to others, right? What does that mean? The compassion we give to others, those feelings of kindness and wanting to help them in their time of difficulty and suffering, we need to direct that toward ourselves. So when we're going through a hard time, when we're going through some difficulty, we're going through some stress, we have to be kind to ourselves. We have to learn to be not so hard on ourselves and not so negative and critical on ourselves. So that is self-compassion. Self-compassion is actively encouraging the expression of warmth, concern, and caring toward yourself. Self-compassion is a positive and caring attitude toward yourself in the face of failures and individual shortcomings. This is, I think, very, very important because this is so hard for medical students and for residents and for practicing physicians, right? Because we're all such high achievers and perfectionists that when we fail or we make a mistake or we don't live up to our own expectations, we are so hard on ourselves. We are so critical of ourselves. So we have to learn to do this. And we're not very good at exhibiting self-compassion, but we have to learn this skill. We have to practice this skill, and it's a very important resilience strategy that we really have to understand and try to implement that.